Hello, this is the daily COVID update from Deccan Herald. I'm Suraksha. On the bulletin today, Karnataka reports 138 new cases, of which more than 100 are returnees from Maharashtra. The RBI makes loans cheaper and extends loan repayment by 3 more months. And we speak to Dr Giridhar Babu, an epidemiologist from Karnataka's Technical Advisory Committee, to get a sense of what is the new normal once restrictions are lifted.
For me, living with virus means how do you protect the vulnerable? And in order to do that, only surveillance and effective containment is the way to go ahead.
But first, a look at the daily figures. At the time of this recording, India has over 50,000 active cases in the country right now and has recorded 3,697 deaths. The ICMR has tested more than 27 lakh samples for the novel coronavirus so far and more than 1 lakh samples in the last 24 hours. The central government's top healthcare advisor has claimed the nationwide restrictions had averted an estimated 37,000 to 78,000 deaths and 14 to 29 lakh cases of COVID-19. Presenting the assessment of the first two phases of the lockdown, VK Paul, a member of Niti Aayog, said that the restrictions had stalled the speed at which the virus was spreading through the country. Citing the figures, Paul said that by April 3rd, the nation was seeing 22.6% new cases per day, but there was a clear slowing down after April 4th, now settling at 5.5%. He also stated that 80% of the active cases were in 5 states, or 60% of the cases are confined to 5 cities. The authority shared that this analysis was made by independent experts using publicly available data. The government's strong defense of the lockdown came on a day when leaders of 22 political parties joined a meeting convened by Congress President Sonia Gandhi. The political parties questioned the government's decision for lockdown, contending that the approach had delivered diminishing returns. Before we take a look at the figures from Karnataka, here are some key updates from the country. The Reserve Bank of India has cut policy repo rate by 40 basis points to 4% to help businesses and public avail cheap bank loans. It has also extended the moratorium on loan repayments by 3 more months in view of COVID-19. The RBI made the first official remark on India's economic growth in 2020-2021, saying it will remain in the negative territory for the most part of the financial year. But along with the rate cut on loans, the interest rates on savings are also exempted to come down. Moving on to the numbers from Karnataka, 138 new cases were reported from the state today. Most of those who tested positive today have a travel history to Maharashtra. Other travel histories include Jharkhand and Telangana. The highest number of cases have come from Chikbalapur with 47 new cases. Hassan is in second place with 14 cases. Raichuru has reported 10 new cases. Mandya and Tumkur have reported 8 cases each. With this, the state has reported 1,743 cases in total, of which 1,104 are active cases. 597 patients have recovered while 41 have died. The state has tested more than 12,229 samples in the last 24 hours. Moving on to a few updates from Karnataka, Chief Minister Yediyurappa has announced that the state will bear the travel cost of migrant workers and stranded persons who want to return to their homes through Shramik trains. These trains are set to run till May 31st. At present, the Shramik trains are run on a 85 to 15 cost sharing ratio, with the states having to bear 15% of the cost, which the travellers have been made to pay in several cases. After a gap of nearly 2 months, the railways has begun intra-state services in Karnataka. The first train left from Bengaluru to Belagavi at 8 a.m. on Friday. But the railways' attempt to resume regular passenger services received a lukewarm response. The KSR Bengaluru-Belagavi tri-weekly special train carried only 338 people, while the train to Mysuru had 37 passengers. The easing of the lockdown has coincided with a sharp increase in cases across the country. Karnataka has been among the few states anxious to get back to normal life. The state government is being guided in all its decisions by a technical advisory committee consisting of epidemiologists and virologists. I spoke to Dr Giridhar Babu earlier today to understand what the future containment strategy is, since more than 6,000 cases were reported from across the country yesterday and 2,000 from Maharashtra alone. I began by asking if India was prepared to deal with the surge in cases.
Absolutely yes. In terms of the time that was available during the lockdown, the states have mounted their response in terms of how to get prepared for any surge in cases. So in my involvement with several state governments, I am confident that we are prepared to meet the surge for reducing mortality. But when you talk of surge in cases, we shouldn't be looking at a scenario where all the people who are diagnosed to have COVID-19 are going to be in a hospital. That's not feasible. Not any country in this world can do that. So home isolation will be the thing to expect in the future. But what we really need to be doing is taking care of the people who need specialized care. And for that, we definitely are prepared, and we are moving towards such kind of priority setting in the healthcare services.
You've been a part of the Technical Analysis Committee for a month now. Karnataka has managed to keep its numbers down, but now that the inevitable has happened, and by that I mean the number of active cases has crossed 1,000 now, what is the state's response going to be?
Now, both for India and Karnataka, I think we should stop looking at how the cases are increasing day to day. Unlike T20, 2020 matches, these dashboards containing case numbers do not mean anything. They only mean that the infection is going to be more probable to be detected when you are expanding your testing capacity. 80 to 90% of the people are going to recover completely. So looking at the absolute number of cases is not going to be very helpful. What is really helpful is to look at how many deaths are there and how the state has done well in terms of reducing it, how the country has done well. There we have done tremendously well compared to any other nation in this world. I think that only should be the goal in the days ahead. And in order to reduce the mortality, if that's the only goal that we are talking about, you need to find as many cases as possible. That's the only way of making sure that people who are at risk of any complications are referred early, treated early, and we reduce the deaths.
Considering that there has been a tremendous rise in cases and we are slowly relaxing all restrictions there was, what exactly is the containment strategy going to be henceforth?
A successful containment strategy involves identifying the cases as early as possible, which we call it as syndromic approach. And now no longer we should start restricting people's movement, because with the release of lockdown in phased manner, what is important now is to detect any case out there anywhere and then make sure that we are doing containment there. So isolation of cases, mostly it will be home isolation at some point of time, in addition to contact tracing and quarantining the people who are at higher risk of infection. This is going to be a successful containment strategy, and this should happen everywhere throughout the state of the Karnataka. In order to do that, you need to have district action plans, task forces even at the district level, at every urban area, and also involving community into containment strategy. One of the reasons why Kerala was successful is because the quarantine, what we call it as sort of a restrictive step, was actually made that very enjoyable by the involvement of community. Even before the person could reach home, the community used to get involved, help them with resources, and this is the way forward. Instead of making it as a stigma, we should be working with the community to make sure that this is going to be here and how do we tackle it better.
As a public health expert, what does the phrase learning to live with the virus mean to you?
See, there are multiple bacteria which live inside our body. There are many viruses that become less pathogenic and stay with us. So this virus also is going to become less pathogenic over a period of time. But before it becomes like that, what is living with the virus mean is that how do you reduce mortality associated with a bad version of the virus which is currently in circulation. While we want to wait for the good version in future or the vaccine, we need to prevent elderly from dying. We need to prevent people who have coexisting diseases from dying. In order to do that, for me, living with virus means how do you protect the vulnerable? And in order to do that, only surveillance and effective containment is the way to go ahead.
You can watch the full interview on our website as well as on our social media channels tomorrow. That's all from us today. For the latest updates, log on to deccanherald.com. Stay safe and we'll see you tomorrow.